And we're very grateful to have, for the second part of today's briefing, Andrew Saberton, the Deputy Executive Director for Management at the United Nations Population Fund. And he's just traveled recently to Afghanistan, and he'll talk to you about that. Please, welcome.
And, good afternoon, everybody. I've just literally this weekend returned from my first mission to Afghanistan. I wanted to visit the country to see the real difference UNFPA is actually making on the ground, and also to better understand the impact of the recent funding cuts. Whilst there, I visited UNFPA-supported services, both in the capital, Kabul, in Bamyan province, and also at the Torkham border with Pakistan. I also met with de facto authorities to reiterate UNFPA's support to the health and well-being of Afghan women and girls. During the course of my visit, I saw and understood the devastating impacts the massive cuts to UNFPA will have in one of the world's greatest humanitarian crises. A crisis that may actually be off the radar of the news recently, but remains one of the world's greatest crises. Just to give some reflections on a few of the places I visited during my mission. Torkham, I visited the basic health facility, the basic health centre, which operates 24/7, providing maternal and reproductive health services as well as social support services for women and girls returning from Pakistan. Many of these women arrive after days on the road, pregnant, exhausted, traumatised, and unsure of what awaits them. Many are returning to Afghanistan, or actually many are going to Afghanistan for the first time in their lives. Just a few miles in from the border, I visited the emergency maternity clinic for women at the Amari camp, which is a transit centre for the returnees, where I met female doctors and midwives working in really challenging conditions, delivering babies and treating women who have endured unimaginable trauma. Now, these UNFPA facilities are not hospitals, but they are a lifeline. Our clinic is the only facility that is immediately accessible to pregnant women returnees as they cross the border. I also visited Bamyan province, where I had the pleasure to actually visit one of our family health houses, a flagship initiative of UNFPA. And whilst there, I spent time talking to the midwives, the psychosocial counsellors, the youth educators, as well as meeting the local Family Health Action Group and the Community Health Shura. To get there, in a remote community in the mountains, it took me nearly 2 hours to travel approximately 30 miles, and that's in a four-wheel drive vehicle in good weather. Unfortunately, those latter things are not available to the local population most of the time. UNFPA ensures no one is left behind, especially those from the most remote and hard-to-reach communities. Our services are community-based with full community participation, which is why there is demand for and acceptance of our services from the communities. Whilst there, I met a UNFPA-trained midwife who was actually born and raised in the community, undertook the training program offered by UNFPA, and once she was qualified as a midwife, returned to her community, where she now works in the clinic, which provides for the first time the opportunity to have safe deliveries in the clinic 24/7. And in addition, she also makes sure that one day a week she does community visits to actually visit women who can't actually reach the community because of the current state of their pregnancies. More deliveries, though, now take place in that clinic than at home in that community. The waiting room was full, mostly of returning patients, and I met women who had walked over 2 hours on rough roads to receive maternal health care. I met the Family Health Action Group, volunteer women who actually support demand generation in their communities for the services of that clinic, of that house. On the day I was there, they was talking about the value and the need for vaccinating themselves and their children. I met the community health shura, the community leaders, all men, but who guide the health initiatives based on local procedures. And I was so pleased to hear their support for the clinic and their desire that their wives, their daughters and their mothers received as good a care as was possible. Whilst there, I also met a group of adolescent girls in their youth education classes or undertaking the psychosocial counselling. On the day I visited, they were receiving education in menstrual health and hearing about the changes that will take place in their bodies. They would hear this from nowhere else other than UNFPA. And they were just so happy to be receiving free adolescent girl kits, which contains little more, or a few things such as menstrual pads and soap. But what I was shocked about during my visit to Afghanistan, over many of the facilities in many of the places I visit, was the actual frequency of seeing young girls receiving counselling or seeking support from their peers. Depressed teenagers who cannot pursue their education, their chosen careers, often channeled into early marriage and motherhood, and usually unable to move without the permission and accompaniment of a male. This was the biggest tragedy, to see a country of so much potential and opportunity but to see that it is denied to half of the population. As one of the girls I spoke to there reiterated to me, for women and girls, hope is a luxury. It's a luxury they can't afford. During my time in Kabul, I visited a hospital where UNFPA is supporting fistula surgery for women and girls. And there I heard various harrowing stories from the journeys some of the patients who actually there had taken. Whole days on the back of trucks because they're often denied the use of any public transport because of their condition. And before they actually even reach the public transport, many of them have crossed mountains, very mountainous terrain, for up to 4 or 5 hours on a donkey or walking. But they come to one of the few fistula centres and repair centres in the country, in Kabul. And it was there I hear the story of the 10-year-old mother who had recently been treated in the facility. But also while I was there, I was able to hear firsthand the story of a teenage mother who had suffered fistula. And as part of being suffered by fistula, she was shunned by her own family and other members of the household. And until the problem was solved, she was actually in total social isolation, actually forced to take her meals with the animals in the compound rather than sit with the rest of the family. UNFPA and its partners are helping to give these girls their lives back and their dignity. These are just a few of examples of our work that we are doing in one of the most trying humanitarian contexts currently in the world. So now I must just go on to spend a few minutes on talking about UNFPA's programme size and particularly the effects of cuts. And perhaps I should be very clear at the outset and not leave us under any illusion. Funding cuts in Afghanistan will result in lives lost. It will also result in an enormous amount of lives, although not lost, are less lived. UNFPA aims to reach 7.3 million people in Afghanistan, 80% of whom are women and girls, with reproductive health and psychosocial support services this year. Already, Afghanistan is already one of the highest maternal mortality rates in the world. With every 2 hours, a mother dies from preventable pregnancy and childbirth complications. The US, in its recent cuts, has cut over $330 million in global funding to UNFPA, to its cuts to its vital life-saving projects that were already underway or had been committed to be starting in the coming months. A third of those cuts were reflected in the Asia-Pacific region, and Afghanistan was the hardest hit, with cuts of $102 million. In Afghanistan, this funding was mostly for the provision of family health houses and mobile health teams and psychosocial support services. And now, as a result of the cuts, 6.3 million people, mostly women and girls, are losing access to this life-saving care. We will be forced to reduce the number of midwives that we support by half. And in 2026, UNFPA will support fewer than half the community facilities it did in 2024. We'll only have 418 facilities left. Currently, we have 982. Hundreds of health centres in remote areas and mobile clinics are being forced to close. Health workers are being laid off. Supplies are running out, and lives are at stake. But UNFPA will be staying to deliver, but we cannot sustain our response without help. We need urgent support to keep these services running and protect the dignity, health, and lives of Afghan women and newborns. There are no birth plans in Afghanistan, only survival plans. And that reality demands us action and not just words. Thank you.
Thank you very much. Before we turn to questions, I was wanting to let those in this room know, if any of you are interested in questions on Yemen, that the special envoy for Yemen, Hans Grunberg, is coming shortly to the Security Council stakeout to talk to reporters. I'll now open the floor up for questions. Edie.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. In your meetings with government officials, did you raise the issue of girls' and women's education, particularly the need for women doctors, women midwives, and the fact that there aren't going to be any in the future unless there is education?
Do I respond? My apologies, it's my first time here. Yes, I did. Whilst in terms of members of the de facto authorities, I met the Minister of Public Health, the Vice Minister of Youth, and the Governor of Bamiyan Province. And in each of those, I raised the issue particularly of the exclusion of girls from education in training as midwives and in health facilities, and particularly highlighted the fact that if education stopping at grade 6 for girls, there will then be no pipeline for when midwives get older, retire in the future, and the country and the services that will able to be provided will actually be catastrophically affected. I made this case, they understood this case. I'm not sure it will result in any particular action, but as a UNFPA and representative and as a humanitarian, it's in my, I'm obliged and want to make sure that they women's and girls' rights and values are actually maintained at the centre point of this. But it was raised in every meeting that I went to. Thank you.
Thanks. Yes, Yvonne.
Thanks very much for this briefing. Yvonne Moriarty, News. Could I ask, please, about the reaction that you got from the de facto authorities about the projected funding cuts, but also from ordinary people? Have you discussed the funding cuts with them and what their reaction was? Thank you. Yes,
of course, the authorities were very concerned about the potential funding cuts. I did promise them, regardless of what funds we've got, UNFPA will remain there, and it will remain, Afghanistan will remain a priority humanitarian country, however we slice and dice the countries and with the funding. They are concerned because we will have to, for many, particularly in the most remote communities, and nearly 30% of the people are in remote communities, this is that the facilities that we provide at UNFPA are the only ones available to them. It's one thing if you're in Kabul, but if you're in Bamiyan Province and the Central Highlands or in other areas, you are days away, given the local transport from the facility. So they are very aware. We did actually I did discuss with the Minister of Public Health, ongoing discussions about the whether the authority could take over some of the facilities we're currently offering, including their basic health service provision. So at least to help support, maintain some of these facilities. But one of the things I promised, and I was going to do anyhow, was to actually make sure that the message of Afghanistan is still heard. It's very, we're all very aware of their world at the moment. So many humanitarian crises going on, but there is still much to do in Afghanistan. And the communities, I cannot say any more other than how supportive they are of our facilities. And in a country where the only political party is the de facto authorities, that's so important to be able to operate and to actually get the communities to actually own and promote and actually support those community facilities there. That's why our flagship program is about having family health facilities in the remote areas, or mother and child facilities. Those were the 972 facilities I was talking about, which we will have to withdraw from nearly or over half of them. We will prioritise the best we can so that we reach as many people as we can with the funding that we get. But the reality is, as I mentioned, it will result ultimately in lives lost and lives less lived. There is no other, there's no other way of saying it. Thank you. I hope that's.
I can't quite tell if anyone online has a question. If you do, please speak up. If not, I'd like once more to thank our guest, Andrew Saberton. Thanks very much. Thanks so much.
Thank you very much.
Have a good afternoon, everyone.